Hi Emily, please can you introduce yourself and tell us what your role is in the LivDem team?
Hi, Zoya. So my name's Dr. Emily Dodd. I'm a Senior Research Fellow at the University of the West of England in Bristol, and I'm in the Centre for Public Health and Wellbeing. I've worked with Rick for over 10 years now at UWE on dementia studies, and my role in the LivDem team is mostly to organise and administer the two course facilitator training sessions that we offer twice a year. And I also maintain the website that we have and the mailing list and send out communications when we've got some. We tend to do surveys once a year with our undergrads. And we've also starting to develop a newsletter. So course facilitators and those on the mailing list will be hopefully getting a newsletter in the next couple of weeks. And we're hoping to send out a newsletter about twice a year, just to give people updates on what the team have been doing and about training and other opportunities to get involved. My main research interest in LivDem though is about how services are adapting and modifying LivDem to meet their needs in the context of their services, whilst making sure that people are still benefiting from the intervention and that they're getting the outcomes that we think LivDem offers people.
Great, and what LivDem projects are you currently working on at the moment?
So, as I say, I've been working around the idea of sort of looking a bit more into the adaptations that individual services are putting on LivDem. And we gather some information from course facilitators through an online survey and through a couple of stakeholder engagement sessions that we held a couple of years ago. And the main adaptations and changes that people told us about was around the number of sessions that they offer LivDem. So the LivDem model is 8 weeks plus one at the beginning and one at the end for carers. Some services, due to demands, will reduce that down to 6 weeks. Another common adaptation is the length of those individual sessions. So whereas the model suggests doing it over 1.5 hours a week, some places have reduced that to an hour session, whereas some are more relaxed and providing it over 2 hours with possibly another break in that 2 hours. There was discussion in the engagement sessions around it is hard to condense the content into 6 sessions, but it's getting that balance between what the services can offer. But the main points that we really took away from those engagement sessions was around the importance of space and pace. So this space of either the 6 or 8 weeks is really important to course facilitators. They say that the person living with dementia really needs that space, that time on their own without loved ones, to be with other people, to be able to talk and share their experiences, to be able to start adjusting to their diagnosis. Secondly, pace around that time gives that group that time to be able to develop those trusting relationships with each other and with the facilitators. And it also gives the facilitators that ability to pace the course delivery to meet the needs of that individual group.
Great, and what are you planning to do with this work now?
Yes, so from those conversations that we had and from the survey, we've now we've been able to develop a programme map for LivDem to look at what we think are the main components of LivDem. And we've started to generate our initial programme theories about why we think it works and how it's working. And with this information, I'm now writing a grant application to do a realist evaluation of looking at what works for whom in what context. So this involves working with different NHS and non-NHS services that are delivering LivDem around the country, to really start looking at the different ways in which it's being delivered and to start developing and refining those programme theories. We're looking for sites that might be interested in taking part in this project. So if you do have an interest in being part of this research, then you can contact us on livdem@uwe.ac.uk.
That's great. Thank you so much, Emily.